everyone. It's Dr. Denisa Weber with Serving Life Chiropractic, and I'm so excited that we get to have this special guest here with us, which is Dr. Agrawal with PGV Pediatrics, and she's an amazing holistic pediatric provider, medical doctor here in Dallas. And our conversation today is going to cover all kinds of different things, but a lot of the things that most moms are wanting to know about what care looks like from a holistic perspective. So I'm excited to have you on. Thanks for joining us.
Thank you so much, Denisa. Thank you so much.
Yeah.
I appreciate being a part of your group. And, we think one specialty is better than the other, but I think just like our nutritional pyramid has different levels and different categories of food just to help our body, medicine is just like that too. To keep our body healthy and well, we need different sources of care, different parts of care. And I think chiropractic care is very important.
Totally. And I mean, it takes a village to keep a family well. And
yes,
thankfully we all have we're parts of, a big body of people that we all have different giftings, and we're purposed in our giftings to help support each other. So yeah, super grateful for you and your lane and your expertise. And, there's so many wonderful families here in our office that benefit from your care. And we're just super grateful that it's more of a collaborative experience than it is a competitive experience and all that kind of stuff, because we can't do what you do. And
I can't do what you do.
Yeah, like totally. And I don't want to do what you do, like that's the thing. So
that's why we have the wonderful group of support system for our patients' health.
Right. Absolutely. So let's kick off there, because I feel like it's a great place to start is at the foundation. We're going to get into knowing you a little bit better, but what is health?
Health, people think about health as physical health. Are you coughing? Are you sneezing? Do you run a fever? That's considered health most of the time. Are you able to go to school? Are you able to go to daycare? If not, then you're not healthy. You're something is wrong with you. But I feel health has more than just the physical health. There is a mental aspect of it. There is an emotional aspect of it. So as long as all these three are well, we have a healthy body and mind. We have a child who's thriving and growing and loving this world. But even if one of these falls apart, emotional or mental health, we see this all the time, the crisis that we have around us. Physical health is more visible most of the time. Mental health, emotional health can be hidden. So we have to dig in deeper to find out where the problem is. Where can we help the child? So I think health has it's like a tripod. It's like a three-legged stool. And all those three legs have to work together and be uniform and balanced. Otherwise, you're going to fall over.
Absolutely. And I feel like, a lot of times parents will see their, kids or even their own health as health is asymptomatic, and they feel like as long as I'm not having a fever, I'm not, having inconvenient symptoms, that means that I'm healthy. What do you say to that?
I tell them, well, look inside you. When you say you're not having any symptoms, are you just not aware of those symptoms? Maybe there are symptoms that you have learned to just kind of deal with, take it in the step of the day and move on. Did you sleep well? Did you wake up this morning without any aches and pains? Was there a bounce in your step, or you were struggling to get out of the bed? Those are all signs of your body, your brain, your heart feeling happy and healthy or not so much. There are symptoms that could be very subtle. If my finger hurts, I look at it, but sometimes if your heart hurts or if you're not feeling well, somebody has hurt you emotionally, you may not even say anything about it to the world. So I think that's where we get confused between what is health, and symptoms not always mean that we're healthy.
No, I feel like same. We have to talk a lot about that, even being nervous system based chiropractors, is like the sensory aspect of your nervous system is only 10% of the feedback that your nervous system provides. So if we're going to base our health on 10% of what we actually know, or just what we feel, like that's not an accurate measure as to what we're doing or how our body is functioning. Especially when it comes to fevers, I feel like a healthy system is challenged. A
Yeah.
healthy system, it is going to have immune challenges. So to approach it and see health as asymptomatic, the only people that are asymptomatic are already in the ground. So like, it's not necessarily the best definition of health.
Yes.
But I think people are exploring that, sometimes symptoms are great. Like symptoms, they may be inconvenience, but especially with
Right.
your kids, like when we
Yeah.
talk about fevers, tell me about the importance of a fever.
So fever is your body telling you, I'm trying to fight something off.
Mm-hmm.
You may feel a little uncomfortable. You may feel like you're feeling very warm, something is wrong. You may feel flush, you may feel tired, but that's all telling you that your body is trying to fight something off internally.
Mm-hmm.
If it's a very high fever, yes, you worry about it because high fevers in kids can have some complications.
Mm-hmm.
However, a low-grade fever, teething can cause low-grade fever.
Mm-hmm.
They teeth from as early as 4 months and they get their teeth, most of them by 2 years.
Mm-hmm.
If I was to give them Tylenol or any medication for fever every single day, every 6 to 8 hours, multiple times in a day, it's going to hurt their little bodies a lot. So fever is good. Little coughs, little runny nose, you get a fever, you get better. Nothing to worry.
Yeah.
High fevers, I worry. Fevers that last for a long time, longer than 4 or 5 days, I will definitely worry about it. At least look at the child, what's going on.
Mm-hmm.
But other than that, fever is just a little sign. Okay, when you're sitting on if you sit on your leg for a long time and it falls asleep, it tells you, okay, get up, move it around so the blood can circulate. That's similar to what fever is.
Right. Do you get that a lot in your office where a parent's just like, we have a temperature, something's wrong, and racing to the pediatrician, and what do we do? And how do you speak to that calming that parent down as to what's going on?
I tell them, fever, don't worry about it, unless it is 102, 103 or higher. Mm-hmm. Look at the child. And most of the time, when you have flu, when you have RSV, when you have a cold, mm-hmm. your body runs a fever, you come in, and I tell you after I look at the baby, give Tylenol or Motrin if you feel that the fever is getting very high. Otherwise, let it run its course. Yeah. You can put a cool rag, you can cool down the baby, mm-hmm. decrease the temperature around so the baby feels a little bit comfortable, but let the body fight. Right. Teething, run a fever, 100, 100.4, 100.8, nothing to worry. Right. 101 or less, I think that's what I tell them. Don't worry. As long as the baby is happy, babies have, smiling, eating, doing what they are supposed to. Mm-hmm. Children are running around and playing with a 101. I think they're fine. Yeah. I think they're okay.
I've heard temperament over temperature does sometimes, because sometimes your kid's not okay and they're maybe running a little lower grade, but you're like, something's off with you, And then my son, he had a 105 and was the happiest dude ever. And I was like, what is going on? Well,
if he's nursing, if he's eating, if he's sleeping, if he's active and coherent, he's all right.
Yeah. They were like, this is the happiest 105 child I think I've ever seen. I was like, as long as we're good, as long as you think everything's fine. But I think I found out that it was so brilliant. I didn't realize this aspect of the body, but when the whole why the fever triggers during teething is how the blood-brain barrier opens up with the teething and how the fever protects the brain from having anything go between that blood-brain barrier. Yes. So I feel like that always fascinates a mother to know, there's a brilliance in the system that says I'm cranking up the temp so that nothing bad permeates and goes to where things are super important. Yes. So,
and if you look at it, women, when they go through their menstrual cycle, some of them, when they cramp a lot, their body temperature gets elevated too. This is your body's reaction. Like you said, it's trying to protect the more important organs of your body and let whatever it is come out, any kind of inflammation, any kind of your threat to your body will get taken care of. So fever, it's a sign, always look at it as how your child is feeling. If your child is happy, not missing a meal, smiling, gives you a hug, has a fever, it's probably okay. If your child is unhappy, grumpy, fussy, crying a lot, not eating, and doesn't have a fever, I'll worry about that baby. There's something going on. So
right. Sometimes the lack of it is
yes,
an indication that we don't have a healthy system, so I'm so glad you said that. Do you find like sometimes it's just that we're too quick to go to the Tylenol, too quick to go to the Motrin, too quick to go, because that's going to impact the liver in some capacity. I just feel like we're just trained to immediately go towards things like,
I think it's advertising. It's how media works. They show a baby who has a fever and then that baby is smiling and healthy. So
well, I appreciate that for sure. And even speaking to that too is, do you find very quickly, like, I feel like antibiotics has become the new, like, Tylenol,
fix it all. Yes. I wish they were all fix it all. We will all be very healthy. Nobody would be sick. COVID wouldn't have happened. Flu wouldn't have happened. RSV wouldn't go around. I mean, so many things would have changed, but antibiotics have their place. And at the right time, if they have to be used. If I have a strep throat, if I have a pneumonia, if I have UTI, yes, of course, we want the body to get this extra support to fight this infection. However, for normal viruses, antibiotics don't work. Even ear infections, over these past 2-3 weeks or 4 months, I would say, we've seen so many cases of influenza. It's going around, and most of these kids come in with high fever, runny, snotty nose. You have their typical flu face, and they also have an ear infection. There are so many studies that have shown that when you take the fluid out of that ear infection, middle ear, and look at it, it usually is viral in nature. So the child was, say, trying to fight off the flu virus, has an ear infection because of the possibly flu virus. I give antibiotics, which is an added stress to your body. And now they are also throwing up and have diarrhea and can't keep their digestive food well. We just make matters worse. So sometimes watchful waiting is a better way. And most of the ear infections clear up. So when they come back in about 10 weeks, 10 days, 2 weeks, those ear infections are gone. If it's a bacterial ear infection, which needs treatment, it doesn't go away. The child pulls on the ears, tugs and complains and cries about it. Of course, we will have to do something. But otherwise, if it's just an ear infection, I found it because you were here because of other symptoms, probably leave it alone. Let's see where we go with it.
Totally. The research showing that like 80% of ear infections are viral. And the sheer volume of prescribed antibiotics, I feel like, we hear that from parents all the time, like, oh, we're going to get on the antibiotic. And you're like, but do we know what we're combating? Like, it's better to know, well, what is it first, and then knowing how to approach it. Do you, I know this myself, but do you recommend homeopathic means before getting to certain stages? And sometimes, like, obviously you have children who come in who are beyond a homeopathic remedy. But what I would love for you to speak to is when you assess the kiddo, you are not one of those that goes straight for the thing, like straight for the heart.
No. And thankfully, my patients understand that too. So what I would say is, again, the parent brings the sick child to the doctor. There's an expectation, make my baby get better. I have taken half a day off. The child is not in school or daycare. I've paid $30 copay, $5 parking. I've come to you and all you're telling me is to wait and watch and baby will be fine. So that doesn't work. You know, my prescription probably can harm that child a lot more times than help, actually. But however, there are supplements, there are homeopathic remedies and Ayurvedic remedies. Like for the ears, we do those fluid behind the ears when we have the viral and it's hurting a little bit. I recommend eardrops. Now, most people don't like those eardrops, but if you put it in the ears and 2-3 days later, if the child is feeling better, then they did work. Of course, you wouldn't put it in an eardrum that's ruptured or there is a tube in the ear, so it goes in. But those homeopathic medicines, remedies do work for colds, runny noses. If you take it on the first day, as it's recommended, and you believe in it, it's going to work for you. I mean, those cough and cold medications don't work anyways. You take it, you don't take it again, you take it again.
And people have faith. I mean, and that's the thing. People have faith in those cough and remedy, situations too. And so it's so funny. It's like, well, what do you think is going to work? Actually does make a difference as well. And, speaking of ear infections, as pediatric chiropractors too, it's like, we're having to talk to parents about sometimes the nerve tension is so high up there.
Adjustments,
and we're trying to make sure that that brain to body communication is optimized. And so that, if there is nerve tension present, it's just not going to allow those muscles to actually produce and push that fluid out of the ear efficiently. And so freeing that up and allowing it to unwind, and then obviously we also open the ears, bless the little babes. We feel like we betray their heart sometimes when they're tender, but opening them up and kind of increasing the plumbing has it helps. And then when they are able to put the drops in, it's like at least their body, we're cleaning what's there, and then allowing the body to start pushing that fluid, whether it's going down or going out, like at least it's going out. So
there is a tube, the eustachian tube, that is very tiny and gets very blocked with colds and runny noses. That's why you feel your head weighs tons when you're sick. And I think some adjustments just to relieve that pressure will help, just to drain the fluid. And anything, if it can come out or drain out inside the rest of your body, will be fine.
Here for it. Absolutely. But I feel like that so many moms and so many parents of little kiddos and toddlers, yes, they were working, they're having to miss work because their kids are navigating this. And so, like even sometimes we talked about fevers earlier, but sometimes do you see a progression of a bacterial, something that probably could have, the body probably could have killed, but because we kept suppressing the fever, that it didn't allow the full, the body still recognizes something's still here. I'm trying to bring it down, trying to kill it.
And it surfaces later on. It comes along later on. And I also feel sometimes after multiple antibiotic use or after multiple viral infections, your body kind of starts getting tired. So if I have the flu first, I got antibiotics when I had no need for it. Then I had RSV and I was wheezing and coughing, and I got antibiotics again because they were worried about my lungs. And then I had something else. Finally, my body just starts to weaken from inside and from all the attacks from the different viruses. Anything can happen after that. We can get yeast infection, we can get super bacterial infections, whatever, you name it, and it can happen.
It just it depletes the body of the good bacteria that's there to protect you. So it's like they're more splayed out. Their whole immune system is more splayed and susceptible after use. And it's like we think that, and then it's like they're on that spin cycle again. So you probably, I know do you recommend pre and probiotics for these kids that have been depleted for so long? Okay, what would you recommend for kids that need to rebuild that gut health, that good bacteria?
So, diet is the best way to build it, but also supplements. So with diet, I would say kefir, kombucha, yogurt, anything fermented gives you that good gut bacteria. But if you want to just take a little powder and not like those strange or strong taste of kefir, kombucha, etc.
Right.
You can do some prebiotics, and I can send some names to you too, Dr. Weber.
Yeah.
Pre and probiotics work amazing. They work wonderful.
Yes.
So yeah, I mean, and most of the time, diet, rest, and a little bit of support goes a long ways. Sometimes I see babies in daycare, they are getting sick after sick after sick. So they come in 1 week, they had something. They come back in another week, they had something else. They come back in. All I tell them, mom, is just take them out for 2 weeks. They're out anyways. They go in for 1 week and they're out for 1 week because you're taking care of them. Just keep them home for 2 good solid weeks. You'll be surprised how quickly this body heals and how quickly this baby gets back to normal. And then when you send them back to daycare, they don't get sick. They just need a break sometimes.
Yeah, that makes sense. That makes sense. And it's also speaks to older kiddos too, because I feel like the over scheduled child.
Oh gosh, yes.
I think it weakens. I think it just weakens the system more and more and more, where they're all just depleted.
Yeah.
And parents are like, I don't know why we're sick. And I'm like,
because you don't rest.
Yeah.
They recommend 8 to 9 hours of sleep for kids.
Yeah.
An average high schooler wakes up at about 6:30 or 7, goes to school, has his activity, everything. By the time they get home, it's about 6:37 on a good day. And then they have at least 4 to 5 hours of homework. So they have to do that. And then high school means you have to have some text messages and social media also, which as bad as it is, but they need it. They
need a break.
They need a break.
Yeah.
So between that, add those 5-6 hours and a couple more, they go to bed around 1 a.m. and they are up again. So the 8 hours of recommended sleep never happens. Even on the weekend, they may try to sleep in late and catch up, but then we have soccer and baseball and dance and ballet and all these things scheduled for them.
Yeah.
I think they're just too scheduled. They are busier than an adult. I think they have a longer day than I have or you have probably.
Yeah. And I know that's not something that a lot of parents want to hear, but it is the truth.
It is the truth.
It is the truth.
And you can't change some of these dynamic because this is part of growing up. However, focus on your diet, focus on your health, focus on your nutrition, and at least ease out some of this tension, some of this stress. Go see parents, go visit grandparents, just be happy, happiness inside. Make your brain tension free as much as you can. I mean, we say that, but then they are so stressed. The kids.
So important.
Yes.
The mental stress component of it, the mental load makes such a physical, like it manifests physically for these, for all of us, but it's amazing what just opening up a little bit of real estate in the brain helps, helps these kids be better, and also for us as well. It's not just for kids, but I can speak to for myself as well.
The parents are equally involved. I mean, they may be sleeping, they may be trying to go to bed at 10, but they're not falling asleep before the kid falls asleep. Right. Personal experience, they're up till 1, I'm up till 1.
Yeah, that's so true. It's so true. To kind of backtrack a little bit, I was going to ask you, did you start as a traditional pediatrician and then go into more of like this holistic mindset? Or did you start out originally in a more of a holistic approach to health and then go into medicine, go into being a pediatrician? Did you serve in a more traditional approach and then kind of bridge over into holistic? Can you walk me through that and for our parents to hear?
Yes, it's a long, complex journey. I was born in India, and all my Ayurvedic and homeopathic experience comes from there.
Okay.
I grew up, I went to high school, I went to Ayurvedic medical school. They have Ayurvedic degrees. So that's where my holistic, more natural background comes from. And then I also wanted the allopathic side of it, the modern medicine side of it. So I went to med school in Ukraine. It's probably destroyed by now with the war and everything. but that's where my school was, and I loved every single bit of my days there.
Wow.
They taught me a different perspective of medicine. So in it was USSR, Ukraine, kind of falling apart at that time. But still, they don't use antibiotics very commonly. They have a different system of medicine, but at the end of the day, it's more diet, it's more supplements, more herbal, and then they add medications if needed, just like what I believe in. Then I came here and I've been practicing medicine since then, but all this time, since all this natural ideology was inside me, it has kept me a little bit different from the rest of the regular pediatric force around us, which, you know, I train. So I have both now. I have my natural background and I have my modern medicine. So I like blending East and West, which I feel is a better way to treat your body rather than just following one or the other.
Right. And I feel like that's so, I think parents trust, I think they increase their trust in you is a little higher because you speak on both of those lanes. Like,
yes, it's
know,
speaking multiple languages, saying different, you know, and helping, not just saying the same thing in multiple languages, but a different essence. I don't know how to explain it. So if I want to use homeopathic or Ayurvedic, I'm happy to use my knowledge that I gained in my Ayurvedic medical school. If I need to use some nutritional support and diet and supplements, I have a lot from Ukraine. And then here I have so much more experience. I've been practicing here almost 25 years now, and every single day has made me believe more that a blend is necessary between the Eastern and the Western medicine. One or the other by itself is not the best one. But if you blend it all together, you get the best care.
Right. And that's where I'm like, it's a holistic approach in your practice is seeing it from different angles and being able to say, this is a time and place to utilize this. This is the time and place to utilize this versus just, I feel like your tool belt is way more extensive than just saying my tools only reside here. And, you know, whereas US, obviously, I think it's US and New Zealand are the only ones that allow pharma advertising on television. The rest of the world bans it. So, you know, so we're very like in the US is very pharma driven and for all kinds of different reasons. And we're not even going to go into any of that, but just more the fact that you have that background, you have that knowledge base, and then you have what you brought from where your upbringing and from your medical school there. I feel like those two merge together, give you so much depth and help our, you know, our community so well. I think parents can really trust that knowing that you do have that allopathic as well here. You know, and so do you see that as well? People are like, oh, I didn't realize I would be getting this holistic, like,
some of them are surprised when I tell them, why don't you try this? And it works. And then they're like, I didn't need to use steroid for my eczema. Well, you didn't need to. I'm glad you didn't need to. And you don't always have to if you do these things in the right way. So you know, I feel medicine is an art. You just have to have the right ingredients at the right time. One or the other recipe doesn't always work. So you have to be creative and you have to think out of the box. So, and I think sometimes blending different things are important.
That's beautiful.
Just like I send parents to see a chiropractor. You know, I feel sometimes that aspect of medicine helps them. And so it's like adding on to what I can give them. When you give them something, it improves their health and wellness.
Totally. And I love that medicine is an art. I feel like the best people in their professions are the artists. Like they're the ones that have more colors to paint with, or they have more options. They're not just so like, it's not black and white. It's very much, again, for the benefit of the person is able to look and say, what is best for this individual? And same thing with like when we adjust people, it's it's different for every single individual because they have different patterns. And so approaching their system is going to be different than approaching even their spouse or their
Yes.
child, and one
Different body
kiddo.
types.
Yeah,
Different body
absolutely.
types. Different.
Absolutely.
Totally.
Can you give us like what as a holistic pediatrician, like what would you say are some of like your most common holistic swaps for medications usually?
So let's say for ear infections, try out the ear drops. I usually use, the garlic oil ear drops
Yep.
for the ears.
Yeah.
They're not just garlic and oil, they're more than garlic and oil. So
Yep.
I remember one time somebody tried to mix garlic and oil and put it in the ear, smelled like garlic bread. I was like, no, that doesn't work. Maybe it works.
Oh my goodness, no. Yeah.
But so that's the biggest one that I use. And
Mhm.
then for colds and remedy, like the flu and stuff, I
Mhm.
do some homeopathic things like roost tox, camphora if they have something in their lungs,
Yeah.
some Kalimor and things like these. And
Mhm.
you'll get those recommendations. Vicks Vapor Rub on their chest helps them decongest, sleep better,
Mhm.
instead of suctioning all the time, which makes their
Yeah.
noses swell up on the inside.
Right.
Breastfeeding is the best remedy. If it's a baby who is nursing, I tell mama, you're strong, you're healthy, give this baby all the hugs and kisses, get all the germs you can, and then make the antibodies and give it to the baby. That's the
Yeah.
best remedy you can give to the child.
Totally.
As they get older, I can make recommendations like flu if you are going through a flu
Mhm.
virus illness, soups with dill, black pepper, bay leaf, those turmeric and ginger.
Mhm.
All these mixed together, it helps fight off the viral load in your body, it decreases it. People think it's just diet, it's it's nothing, but if you do it, you really feel better.
Yeah.
Same thing if you have some essential oils that you can use on your feet, in your dispenser, in your shower.
Yeah.
They help with the symptoms too.
Yeah.
So again, you have to believe in these treatments for these to work.
Yep.
If you don't believe in it, nothing works. Even antibiotics don't work. Well,
Yep.
they didn't work because of the they were
Yep.
not needed, but
You believe whatever you're using, you're already believing in it, so
Yes.
it's like you just having the knowledge to understand what these things do and how they're utilized, and also
Right.
knowing that they've worked for other people helps people go, I'm going to take a chance, I'm going to try this out.
Right.
I mean, what
And
can
these
you
don't
hurt?
hurt. They're
It
not going to
doesn't hurt.
cause any damage to
I
your baby,
know.
or your child, your body.
Yeah,
So
I know.
but
They're effective and they are not going to, I mean, what's it going to hurt? Nothing to
yes,
try it
yes.
out. So
Even the homeopathic medications, if you take 6 instead of the 5, like I recommended, 6 little pellets instead of 5,
yeah,
it's not going to hurt.
right,
Versus if you took an extra teaspoon of amoxicillin every time, it will be bad for your body.
right, correct.
These medications have a different way they work on our bodies. So I think
Yeah.
they're much safer. We don't see immediate effect. We don't see them work instantaneously, which sometimes is what they are looking for, what the patient is looking for. But if you give them 2 days, they will work.
Yeah, I think it's, yes, we want the Amazon Prime response in our system, but it's not the most strengthened response. And if we're
No.
looking for long-term health, long-term strength of our health, then I think, going this route is a little bit, you get more of the long-term gain versus the short-term relief
Yeah.
instantaneously, but you end up paying for it over and over and over and over again.
And
So
it weakens you.
totally, and you end up depleted. So I think if you can kind of see it in that kind of broad spectrum, it helps people understand why
Yeah.
we want to go this route a little bit more. I mean, time and place always, but I think hearing that from you is super helpful for our parents to hear as well. Can you tell us a little bit more about, I know you've talked about this, but why you recommend chiropractic to your patients?
It's a wonderful supplement. So whatever you do there, I can say, when I send you a child who's spitting up, their spitting up is better. I think something worked because I didn't do anything other than tell mom to keep the baby upright and feed slowly. So you did something there.
Yeah.
When I send you a child with ear infections and they stop getting, or their ear infection frequency decreases, then your adjustments worked.
Right.
I mean, think about it. This little baby, he's curled up inside mommy in this tight space. A
Mm-hmm.
reason for that. They need that. I mean, if they were all sprawled out, we wouldn't be able to breathe and anything.
Right.
So they need to be in that ball. But that
Right.
tight position sometimes makes them favor one side more than the other.
Right.
Sometimes their muscles are tense. Sometimes they can't turn their head to one side. Sometimes
Right.
their jaw is tense and they can't nurse efficiently.
Right.
Sometimes they just spit up. They just don't digest the food. It doesn't
Right.
go forward anymore. So all these things, if I feel the chiropractic adjustments work, and that's why I believe in you. And I think if my patients overall are getting better, why not use this? Just like I use homeopathy, just like I use Ayurvedic medicine.
Yeah.
I love using chiropractic medicine.
Well, that's the cool thing about it. And what's so neat is that we basically are just telling people a little bit more about how their body's built and kind of giving that health response, giving them back the responsibility for their health, like being empowered in their choices, understanding how their body works. And what's cool is just clearing interference in a nervous system and seeing how their body starts responding with more balanced symptoms versus imbalanced symptoms. That's the opportunity we're trying to give through chiropractic to a child, because they're growing and developing, and it's an important time to stay clear and connected, and all these things, starting out life well, and even meeting kids in different stages of their life. And so that's why we love this collaboration too, because you need all these people in your corner. It's not either or. It's not an or, it's an and that's where I feel like that, parents, if they have the right people in the right corners, they're not getting mixed conversations, mixed recommendations, or you need to only listen to me. It's more of like, this is a person I trust that is going to know their lane so well and is able to support you in your family's health. And then we're just trying to make sure that whatever, your nervous system is as clear as possible, so that when you do these homeopathic remedies, they work well. Your system is responsive and works well. We want to increase the efficiency of your nervous system so that your health is strengthened when you combat problems, when you combat challenges or whatever life throws your way. Hopefully your system is equipped with what it needs to do what it needs to do. So I love getting, obviously we love getting referrals, but we love seeing these parents wake up and understand why their child's body's responding the way it is. And so, they trust you, and they should. And we love sending people to be we know someone you're gonna want in your corner, because she knows a lot and could help you out with this. So we're just grateful that you're there. I wish that there was 20 more of you. Because I feel like people's health would benefit so much in this community and all over. I think, I think it's going to be helpful for parents to hear that this is an option. You are a pediatrician who is approaching it from a very holistic perspective. And by holistic, we don't mean hokey. We mean we're looking at the entire being.
Entire body.
The entire body. And that's the whole picture. And I would want someone to look at my health from a whole perspective versus an isolated thing. So
and time, and I recommend yoga, I recommend music, because all these help you. It's like little inputs from everything that help your body become a healthy being, or a healthy person, mental, physical, emotional. So you're able to focus more, you're able to learn better, you're able to enjoy this beautiful life without having to worry about not going to school or whatever, the challenges that kids face these days.
Perfect. Well, thank you so much for sharing your wisdom with us today. And I'm so grateful for you, your practice here in Dallas. If you guys have not checked her out, she's Dr. Agrawal. She's near Baylor, and she is in the heart of Dallas at PGV Pediatrics. Thank you all so much. Again, this is Dr. Denisa Weber with Serving Life Chiropractic. We're in Snyder Plaza in University Park. So look us up, servinglifedallas.com. And if you don't find her, we will make sure to recommend you to her. So
thank you, Denisa.
Yes, thanks for joining us, everyone. Bye for
Bye.
now.
Take care.
Yeah.
Bye.